Broadleaf Health and Education Alliance is a U.S.-based nonprofit dedicated to developing innovative approaches through health and education in rural areas of the Eastern Himalayas.
In 2007, Mike and I had finished college and we decided to come to India for some time and do about a 3-month volunteering stint here. When we turned up in Halderkoti village, we kind of fell in love with the place and the people there and really found a second family. So we ended up staying there for just under a year, and while we were there we were involved in a lot of different projects.
Denan took the lead teaching the nursery KG class at a government primary school. I completed a variety of health projects, including assessing the healthcare on a tea estate there. Our key project was developing and founding the Makabari Community Learning Center.
Mike and I came up with the idea for this and approached Chai Project, a local NGO, to build the building for us and the estate to allow us to do this project. And essentially our idea was to just ask people from home to give a little bit of money, and we'd buy some books and put them in a building, and it turned into much, much more, and a really, really fabulous resource center, I think. And this is Yantin, one of my old students.
This is a book. This is a TV. This is a TV.
Yes.
This is a computer.
What's your favorite thing in the library?
Favorite. Look out! Sheep on the track. Blue train make them run. Toot toot.
That was amazing reading. That was so good. Awesome.
These experiences that we had in Halderkoti are also really important to understanding the background for Broadleaf Health and Education Alliance, and they form the core of our beliefs and how we approach development work in this area.
The Eastern Himalayas stretches from eastern Nepal into Darjeeling and Sikkim, the rest of Northeast India, and Bhutan. The landscape of this region is absolutely stunning, with the Himalayan mountains as a backdrop. However, it's very harsh terrain.
The residents of rural communities throughout the Eastern Himalayas face stagnant economy, poor infrastructure, and struggling public health and education systems. Due to the difficult terrain, the remoteness of the region, the political instability, the fact that many of the inhabitants come from minorities, ethnic minorities, tribes, and other under-recognized castes, there's been a relative lack of focus within the international development community. Particularly Northeast India is deemed to be very sensitive or unstable and difficult to work in, and so there are only a handful of international NGOs that have tried to tackle the challenges faced by people that live there.
There are people who come to Darjeeling and they always think that Darjeeling is like a better off place than rest of the India, but it's just towns or the superficial thing that they see in Darjeeling. But if you actually dig deeper and look into the problems with Darjeeling, there's it's got I think it's got most number of issues than any other part of India, and it's always the people of Darjeeling has always felt neglected. And
we think that one of the great strengths of Broadleaf is the focus that we have. So we're very focused on health and education and on being innovative. So rather than providing infrastructure, because people are doing that here and they're doing it really well, we feel that the position for Broadleaf in this region is thinking outside the box and trying to create new models and pushing the thinking a bit further along. So TIP is the first program that Broadleaf has been doing in the Eastern Himalayas, specifically in Darjeeling region. And what it is it's a comprehensive model for school health. It's comprised of 3 primary components. Basically, we take people from the community who have been chosen from the community, and we train them in healthcare and education. Then they go into the schools and they teach a health curriculum to the children, And they do early health interventions and basic screenings of the children, and it puts the students into contact with basic primary health workers. And finally, we make sure that the schools are healthy psychosocial and physical environments. In the first few years, that means making sure that the schools have water systems and making sure that the schools have toilets, but eventually it morphs more into making sure that the schools are all around healthy places for children to go to school.
Wash your hands. After toilet. Use your tooth. During toilet. Thank you.
So given all these needs, we really see a space for an organization that is focused on pushing the boundaries and developing innovative models and really bringing critical, hard thought and well thought out approaches to health and education in this area. On one hand, we focus very strongly on partnering with the schools and partnering with the communities and empowering the communities to improve the health and education of the children at their school. At the other end, though, we focus on bringing our technical expertise and our rigor to develop an evidence base for this model. And after we have an evidence base that demonstrates the validity of our idea, we can then make an argument to scale this up across the Eastern Himalaya.
We also think it's very important to push everyone's thinking and to push things that may seem impossible toward a realm of possibility, and to think outside the box and think creatively about problem solving and bring truly innovative ideas to the table when we're considering the projects that we do and the way in which we work. First of all, we feel compelled by this area, and we feel that it's kind of a second home for us, and that we have a place here as personally as well as professionally. I think that we're compelled to use our knowledge base and our resources as a vehicle for dramatic change in this area. Broadleaf focuses on low-cost and high-impact projects in a neglected region of the developing world. It is through the generous support of donations that Broadleaf is able to carry out its mission. For more information on Broadleaf or to donate, please visit our website at broadleafhea.org.